The use of simulation is very important for the engaged learning process for students. Students must work with our simulated environment in a way that they are mimicking what happens in the healthcare setting. And our environments, some of them are acute care settings like the hospital setting, and some of them are primary care like a clinic setting, or there's a home environment simulation area. So our students get the opportunity to engage with the simulated environment to provide safe care.
A great deal of work goes into simulation. It starts with a thought, an idea that comes from faculty and from our observation as simulation experts about what we need to help the students become more competent in what they're doing.
The simulation staff and faculty really add to the simulation experience because they're able to control everything, and they really can make us get the most out of the simulation. So they are the voice of the patient, they're the provider, they are anything else we may need going into this simulation, and they can really make it a well-rounded experience.
Simulations have really, especially when I was a student, made me feel more comfortable and confident as I was developing my fundamental nursing skills. And now as a practicing nurse, it helped me become more comfortable with communicating with patients because I had that kind of experience when I was here, and doing the different scenarios that are so applicable to real life and running through the skills, running through SBARD, the different parts of handling a patient and working as an interdisciplinary team.
So we even use standardized persons to ensure the realism of any particular simulation that we're doing. So we may have a mother, daughter, son, father, friend who's an actual person standing next to the mannequin and talking to them as if they are their real relative or a person of interest.
We basically give that level of realism that students need to understand what it's like to interact with a human being.
They can work as a team, so teamwork and that practice of being a team is very important. Also, it helps them reflect on what they've done.
Simulation is a dynamic learning process, and all simulation involves creating dynamic learning situations for students to develop critical thinking skills, clinical reasoning, and confidence to take care of patients in the real world.
It's actually kind of funny because coming into college, I did not know what I wanted to be when I grew up. So I was a kinesiology pre-PT major, and I decided to take up the chronic illness minor, which is a wonderful minor that sets JMU apart from all the other schools that I looked into. And then I realized quickly that nursing was something that I was passionate about and helping others, and I felt like that was the best fit. And I was lucky that the school that I chose happened to be the best program that I can say out there for nursing.